Hello, welcome to everyone and greeting to all. I am Dr. Irfan Ahmed, working as a medical lecturer in microbiology, virology and immunology department of the Samarkand State Medical University. So today we will going to discuss about the immune status, immunodeficiency, specific prophylaxis and the treatment of the infectious disease. So let's move on. Indication for an assessment of the immune status, detailed examination of the human health, genetic defect of the immune system, primary immunodeficiency. The third point is acute and chronic bacterial, viral and protozoan disease, in which hepatitis, sepsis, chronic pneumonia, leishmaniasis and AIDS, etc. Number fourth point is autoimmune disease, rheumatism, rheumatoid arthritis, systemic lupus erythematosus, etc. Dermatoviral disease, which is contact dermatitis, pemphigus vulgaris, mycosis, fungoids, and syphilis, etc. The sixth point is tuberculosis and leprosy. The seventh point is allergic disease, which is bronchial asthma and atopy, etc. The other immune status is malignant tumor, which is leukosis, lymphogranulomatosis, lymphosarcomas. The ninth point is a cycle disease like a narcolepsy and schizophrenia. The 10th point is examination of the patient in the gerontological and endocrinological hospitals. The 11th point is the control of the cytostatic, immunosuppressive and immunostimulation therapy. The 12th point is examination of the recipient before and after the transplantation. The first level test of the assessment of the immune status approximate number 1 is determination of the total quantity of the lymphocyte in peripheral blood, absolute and relative. The second point is the determination of the T and B lymphocytes in peripheral blood. The third point is determination of the concentration of the main class of immunoglobulins. The fourth point is the determination of the phagocyte activity of the leukocytes. The next point is the second level test for the assessment of the immune status, analytical. The first point is a determination of the subpopulation of the T lymphocytes, which is CD4 plus and CD8. The leukocyte migration inhibition test, examination of the proliferative ability of the T and B lymphocytes. The lymphocytes blast transformation test, the cutaneous test for the hypersensitivity, the determination of the circulating immune complex, determination of the B lymphocytes which carry the superficial immunoglobulins, the assessment of the immunoglobulins synthesis in the B lymphocytes culture, the assessment of the activity of the K cell and natural killer cells, examination of the component of the complement system. Number 10 point is a assessment of the different stages of the phagocytosis. The next slide is immunodeficiency disease. We will elaborate the severe combined immunodeficiency thymic aplasia, DiGeorge anomaly. We can also call the DiGeorge anomaly. So XLA Bruton, A gamma globulinemia, common variable immunodeficiency, selective IgA deficiency, Wiskott-Aldrich syndrome, which is ataxia telangiectasia, the chronic granulomatosis disease, cardiac Higashi syndrome, hyper IgE syndrome, Jobs syndrome. You can see in the picture the precursor lymphocytes, which is in the DiGeorge syndrome, severe combined immunodeficiency, A gamma globulinemia, which is also B and T cells, which also mature in the T cells and the thymus cells. So tuberculosis, leprosy, Hodgkin's disease, chronic lymphocytic leukemia, lymphoma, cell-mediated immunity, humoral immunity. On the other hand, other defect in the host defense, other lymphoid tissue, distress, nutrition, physical conditions, which is non-septic host defense. So this picture is divided into the primary immunodeficiencies and the secondary immunodeficiencies. So we will move for the next picture is immunodeficiencies. The immunodeficiencies can occur in any of the fourth major component of the immune system. One is B cell antibodies, second T cell, third one is complement, and four is phagocytes. The deficiencies can be either congenital or acquired. The congenital immunodeficiencies, the B cell deficiencies, a X-linked hypogammaglobulinemia brutans, A gamma globulinemia, very low level of all immunoglobulins IgG, IgA, IgM, IgD, and IgE. A virtual absence of the B cells are found in young boys. A female carrier are the immunologically normal. Pre-B cells are the present, but they are failed to differentiate into the B cells. On the other hand, B selective immunoglobulins deficiencies, IgA deficiencies is the most common of these. IgG and IgM deficiencies are the rare. Patients with a deficiencies of IgA typically have the recurrent sinuses and lung infection. The cause of IgA deficiencies may be failure of a chain gene switching. The patient with the selective IgM deficiencies are the deficiencies of the one or more of the IgG subclasses also have the recurrent shine pulmonary infections caused by the pyogenic bacteria such as S. pneumoniae, H. Haemophilus influenza, and S. aureus. The T cell deficiencies, a thymic aplasia, the DiGeorge syndrome, severe viral fungal and protozoal infections occur in affected infants early in the life. A result of a profound deficiency of the T cells, both the thymus and parathyroid failure to the develop properly. The most common presenting symptoms is tetany due to the hypocalcemia caused by the hypoparathyroidism. Other congenital abnormalities are the common. A transplant of the fetal thymus may reconstitute the T cell immunity. Combined B cell and T cell deficiencies. The combined B cell and T cell deficiencies, a severe combined immunodeficiency syndrome, a disease, recurrent infections caused by the bacteria, virus, fungi, and protozoa occur in early infancy, means 3 months of the age, because both B cell and T cell are the defective. This is a group of the inherited disease, all of which are due to the defect in the differentiation of an early stem cells. The Wiskott-Aldrich syndrome which is called is a recurrent pyogenic infections, eczema, and the bleeding caused by the thrombocytopenia characterized by this syndrome. These symptoms typically appears during the first year of the life. The defect appears to be an inability to the T cells to provide the help the B cells. Ataxia telangiectasia in this disease, ataxia telangiectasia, and the current infection's appearance by the 2 years of the age. It is an autosomal recessive disease caused by the mutation in the genes and encoded DNA repair enzymes. The complement deficiencies. It is a hereditary angioedema. This is an uncommon autosomal dominant disease caused by the deficiency of the C1 inhibitors. The recurrent infections, the patient with the deficiencies in the C1, C3 or C5 or the latter components of the C6, C7 and C8 have increased susceptibility to the bacterial infections. The patient with the C3 deficiencies are the particularly susceptible to the sepsis with pyogenics bacteria such as S. aureus. The autonomic disease, the autoimmune disease, patient with the C2 and C4 deficiencies have the disease resembling the systemic lupus erythematosus. Phagocyte deficiencies, the chronic granulomatosis disease. The patient with this disease are very susceptible to the opportunistic infection with the certain bacteria and fungi. The S. aureus enteric gram negative rods, especially the Serratia and Barcularia and Aspergillus fumigatus. The chronic glomerular disease due to the defect in the intracellular microbial activity of the neutrophils as a result of the lack of the NADPH oxidase activity similar to the enzyme. Chidiac-Higashi syndrome. In this autosomal recessive disease, the recurrent pyogenic infections caused by the primarily by the staphylococci and the streptococci occur. This is due to the failure of the lysosome of the neutrophils to empty their content. So, in this picture you can see the clearly the baby face from the lateral view and the anterior view. In this picture you can see the baby, the redness of the face, the baby with the different conditions and the stages of the disease. The David, the boy born without any immune system, shown at the age of the 6 in this self-contained sterile space suit, a mobile isolation system designed for him by the NASA, and other equipments include the push chart with the battery powered the motor and the seat. In a widely publicized case of the severe combined immunodeficiencies, a boy named by the David was kept alive is isolating him in a sterile chamber. He was known as the bubble baby. He was delivered by the cesarean section under the aseptic condition and keep in the sterile environment. He died after attempting to infuse his body with the lymphocytes to establish the immune response. Today, gene therapy and the other treatment are being used to cure the severe combined immunodeficiency disease. The acquired immunodeficiencies, in which B cell deficiencies, common variable hypogammaglobulinemia, the T cell deficiencies, a acquired immunodeficiency syndrome, measles. Patient with the measles have the transient suspensions of the delayed hypersensitivity as manifested by the loss of the PPD skin's purified protein derivative skin test reactivity. The complement deficiency is a liver failure. A liver failure is caused by alcoholic cirrhosis or by the chronic hepatitis B or the hepatitis C can reduce the synthesis of the complement protein by the liver to the level that severe pyogenic infections can occur. Neutropenia. Patient with the neutropenia present with a severe infection caused by the pyogenic bacteria such as S. aureus and S. pneumoniae. Neutrophils count below the 500 microliter predisposed to these infections. The common cause of the neutropenia include the cytotoxic drug. Chronic fatigue syndrome, chronic fatigue, immune deficiency and the dysfunction syndrome. The immunization. The second artificial method to make an individual immune to disease. Active immunization, administration of the vaccines so that the patient actively mounts a protective immune response. A passive immunization means individual acquire the immunity through the transfer of the antibodies from by an immune individual or the animal. The Chinese noticed that the children who recovered from the smallpox did not contract the disease a second time. Young children were inoculated with the material from a smallpox scab to induce immunity process known as a variolation. Edward Jenner found that protection against the smallpox could be induced by the inoculation with the material from the individual infected with the cowpox, similar but much middle disease. So you can see the brief history of the immunology. Relatively new science origin usually attributed to the Edward Jenner, but has deep roots in the fox medicine. Jenner discovered in 1796 that cowpox vaccinia induced protection against the smallpox. Jenner called his procedure vaccination. In 1670, the Chinese medical practitioners variolation. The Edward Jenner 1749 to 1823 vaccinated James Phipps in about 1800 with cowpox material, resulting in the development of the resistance to the smallpox infection by the boy and thereby the establishing the scientific credibility of the vaccination to the prevent the disease. So this pictures describes us how James Phipps vaccination to the baby is a very low dose of the pox materials for the invent the and increase the immunity to the baby. The next one is a number of countries with one or more cases per month. 30% is the maximum range, 50% is the medium range, and 0 is a 0%. In 1965 is more cases of the smallpox, and in 1970 is the middle of age 15, and in 1975 is a very low mode of transmission and spreadness. In 1980 the smallpox officially eradicated. It took almost 2 centuries for the smallpox vaccination to become the universal. Vaccination enabled the WHO to announce 1979 that smallpox has been eradicated, arguably and greatest triumph in the modern medicine. In Louis Pasteur developed a vaccine against the Pasteurella multocida. The practice of the transferring the protective antibodies was developed when it was discovered that the vaccines protected through the action of the antibodies. In 80, in 1880, the Louis Pasteur devised a vaccines against the cholera in chickens and developed a rabies vaccines that prove a spectacular success upon its first use in boy bitten by the rabbit dog. These practical triumph lead to the search for the mechanism of protection and development of the science of the immunology. In 1890, the Emil von Behring, and Shibesburo Kitesto discovered the serum of the vaccination individuals contain the antibodies that specially bound to the relative pathogens. In that pictures, you can see the pastures administering the rabies to the Josepher Master, a 9 years old boy who had been bitten by the rabbit dog. The vaccine saved his boy's life. So, the rabies vaccines, you know very well. The rabies vaccine basically from the dog bite prevention. So, lastly, in last so many years, the rabbit vaccines have the 14 dose, but now in an odd days dose like 3, 5, 7 and 9s have the 5 to 7 injections, which is going to inject the patient for the prevention of the rabies and prevent from the rabies clinical feature. Three general type of the vaccines: attenuated live, microbe treated to lose the virulence but retained antigenicity, killed inactivated, toxide, toxin treated with the heat or formaldehyde to lose the toxicity but retain antigenicity. The next one is attenuated vaccines, also called the modified live vaccine. Also called the modified live vaccines use the pathogens that are living but have reduced virulence so they don't cause the disease. Means is the very attenuated is going to be a die is very weak pathogens that our cause the our immune system will be a strong and make the antibodies in our body. So in our practical sessions, so many vaccines are the attenuated. The attenuation is the process of reduce the virulence. Viruses often attenuated by the rising them in a tissue culture cells for the which they are not adapted until they lose the ability to produce the disease. Bacteria can be avirulent by the culturing under the unusual condition or the through genetic manipulation. In picture you can easily see the left side a culmate is center is scanning of the electron micrograph of mycobacterium tuberculosis. A right side a comparison of a efficacy of the BCG vaccines in different population and areas of the world. If, for example, a vaccine's efficacy in from minus 900 to 0 and 90 population. So in blue color, the controlled trials in which you can see the British school children and American Indians, USA Chicago infants, Puerto Rico Gen Pop as India, USA Georgia and Alabama as India, and USA Georgia children. On the other hand, case controlled study in Brazil, Sao Paulo, Brazil, Belo Horizonte, Argentina, next one's Cameroon, next is Canada, next is Indonesia, Jakarta, in Burma is Rangoon, and next is Sri Lanka, the next one is Colombia, the next one is Argentina, and Togo and Thailand. So this is the control study and control trials of the Mycobacterium tuberculosis and the BCG vaccination results in the all over the globe. So which is going to describe the how many children, how many peoples are affected per years. So how do we make attenuated viruses? How do we make means how we will make the attenuated viruses? The pathogenic viruses is isolated from the a patient and grow in the immune human culture cells. The culture viruses is used to infect the monkey cells, and then the virus acquires many mutation that allow in it to grow well in monkey cells. The virus no longer, the next pictures you can see, the virus no longer grow well in human cells. It is attenuated and it can be used for a vaccines. So this is describes all the procedure from the pathogenic viruses, which is isolate and then cultured in the laboratory, and then you can cause the mutation by yourself in the laboratory. So and then when the cells are attenuated, and then you can easily inject or for the trials inject the patient for the trial the how pathogenicity or the virulence are observed. So this is a basic procedure. So rubella and sabin polio vaccines were derived by the passage of the through the monkey kidney and duck embryo cells respectively. So this is a very interesting procedure. So in which the scientist describes as the rubella and polio, sabin polio vaccines, which is described by the passing of the monkey kidney and the duck embryo. Attenuated vaccines can result in the mild infection. Attenuated vaccine can also cause the mild infection but not disease. Only little bit activate the immune system but not cause the disease. So contain the replicating microbes, is replicating the microbes because our immunity is increased, that can stimulate the strong immune response. You can also know, so if a weak immune antigens come in the our system, and then our immune system will respond and to the large number of the antigen molecules are made. So on the other hand, viral vaccines trigger a cell mediated immune response that dominated by the Th1 and cytotoxic T cell. Vaccine individuals can infect the those around them, providing the herd immunity. So vaccinated individuals can also infect those around them, providing the herd immunity. So next one is problem with the attenuated vaccines. The attenuated microbes may retain the enough virulence can cause the disease. So, especially in immunosuppression individuals, the pregnant woman should not receive live vaccines due to the risk of the modified pathogens crossing the placenta. The modified viruses may occasionally revert to the wild type of the mutate to a virulent form. So in this the problems with attenuated vaccines is we will give the attenuated vaccines as per instruction and as per supervision of the medical professionals, and not very commonly used in the pregnant lady, because it is also called the some problems in placenta, because due to the crossing the placenta and reach to the baby, so ultimately reach the problems to the baby. Inactivated vaccines can be either whole agent vaccines or with the deactivate but whole microbes, or subunit vaccines produced with the antigenic for fragmentations of the microbes. Both types are suffer than the live vaccines, since they are cannot replicate to the mutate to the virulent form. So when microbes are killed, must not alter the antigens responsible for the stimulating protective immunity. Formaldehyde is a common use to inactivate microbes by crossing the linking their protein and nucleic acid. So recognize as a exogenous antigens and stimulate a T2H response that promote the antibody mediated immunity. So inactivate vaccines also activate the immune response as a immune antibodies mediated immunity. So both types are the safer than the live vaccines, since they cannot replicate to the mutate to the virulent form. So can be either the vaccines produced with the subunit vaccines produced by the antigenic fragments of the microbes. So let's move forward. You can see the different process in this picture. The poliovirus grow in the monkey kidney walls, random selection of the mutants, the further clinical test, and the vaccine develops, introduction of the polio vaccines, United States, and incidence of the paralytic polio, Latin American. So in these pictures, we can see the attenuated vaccines can be produced by the multiple passage through the animal cells, tissue cultures. Poliovirus for the oral vaccines was developed by the passages through the monkey kidney cells. Following clinical trials, the use of the vaccines greatly reduced the incidence of the polio in the United States. Elsewhere, where the vaccine is not used, the incidence of the polio is remain high. The problem with the inactivated vaccines do not stimulate the herd immunity. Whole agent vaccines may stimulate an inflammatory response due to the non-antigenic portion of the microbe. Antigenically weak, since the microbes don't reproduce and don't provide the many antigen molecules to stimulate the immune response. The administration is in high. The administration in high or multiple doses, or the incorporation of an adjuvant can make the vaccines more effective. Adjuvant are the substances that increase the antigenicity of the vaccine. Adjuvant may also stimulate the local inflammation. High and multiple vaccines doses may produce the allergic reactions. So in that picture, the problem will describe the inactivate vaccines. What is the administration of the high and multiple dose? If we will give the adjuvant substance to increase the antigenicity of the vaccines. That may be the local inflammation will be discovered. The local inflammation will be happen, and then on the cover of the local inflammation we will give the anti-inflammatory drugs to the patient. The next one is the general properties of the attenuated live and inactivated vaccines. In attenuated vaccines, the virulent pathogens grown under the adverse condition are continued the passage through the different host. Single boost can be unstable. Induce both means it can attenuated vaccines can induce the both humoral and cellular immunity. Reversion of the virulent form possible like the 7 vaccines, 1 case per 4 million doses. Contamination with other viruses, SV40 from monkey present is a 7 vaccine. On the other hand, inactivated vaccines is the inactivation of the virulent pathogens by the chemicals, formaldehyde or irradiation with the X-rays, multiple boost, stable important for the third word, induce primarily humoral immunity, no reversion provide the inactivation is a complete. So attenuated organisms confer the better immunity but the less safe. So you can listen the less safe because induce the primarily humoral immunity, and also it can be unstable and induce the both humoral and the cellular immunity. So this is that's why but not the safe. Live attenuated vaccines. The live attenuated vaccines are the major class of the vaccines for the intracellular pathogens, as these agents lead to the active infections and the propagate in the body. The suitably attenuated strain require the low doses of the vaccines and leads to the lasting from the immunity that is both antibody and cytotoxic. Live attenuated vaccines therefore are the ideal vaccines if attenuation can be achieved and can be maintained. If attenuation is stable and reversion to the virulent of the phenotype of the occurs. So in which live attenuated vaccines categorize into the inactive and attenuated. The cost inactivated is higher, greater mass required. The attenuated lower, the cost is lower because the agent replicate in the body. Administration prenatal, parenteral, and attenuated is the oral. The adjuvant inactivated have the needed and attenuated don't needed. The stability, the inactivated is a good and attenuated is a poor. Reversion in which absent and on the other hand is a possible. Immunity, mucosal immunity absent, antibody mediated, short lasting. On the other hand, mucosal immunity present, antibody mediate, and the cytotoxic T cells, which is long lasting. So live attenuated divided into the inactive and attenuated. The inactivated is higher in price and attenuated is lower in price. So this is a major differentiation between the live attenuated is inactivated and activated. So next one is the toxoid vaccines. So chemically or the thermically modified the toxin vaccines that stimulate the active immunity, useful for the some bacterial disease, stimulate the antibody mediated immunity, require the multiple doses because they possess few antigenic determinants. Toxoids, you know the tetanus toxoid in which is very common in our community, because most presently tetanus toxoid infections are from the fresh wounds, which is contaminated with the soil and rust, in which we will give the human tetanus immunoglobulins, and we will also give the tetanus toxoid 0.5 ml IM injection to the patient for the prevention of the active clinical features, which is lockjaw, which is line-like face due to the extreme facial muscle contraction, and rises sardiconus, and next one is opsithonus, which is upward extended postures like a horror appearance. So we will perform the culture and sensitivity, and then we will also perform the rocket appearance. So in the options of the treatment is the specific and supportive treatment. Supportive treatment in the patient will move on the mechanical ventilation, muscle relaxant, anti-epileptics, and the patient nursed in the dark and quiet room. On the other hand, immunoglobulins and tetanus toxoid vaccines. So in this picture you can see the tetanus toxoid give to the immunized horse, then immunized horse serum returns antitoxins, which is patient at the risk of the tetanus, patient is protected. The modern vaccines technology. Research attempt to make the vaccines that are more effective, cheaper, and safe. A variety of the recombinant DNA technique can be used to make the improved vaccines. The modern vaccines technology. The modern vaccine technology, the variety of the recombinant therapy. With the help of the recombinant therapy, recombinant genetic engineers, we can make the lot of vaccines which is very effective, cheaper, and safer. The production of the vaccines, the component of the vaccines, harmless, attenuated pathogens with the alter antigenous production of the vaccines, which is antigens, virulence of the gene is deleted. That's why the virulent pathogens with antigen. This is the very first case. Then on the second hand, the antigen molecule which have the cell synthesized antigen. Second one is a yeast cell, which is insertion of the DNA into the yeast or the other cells. Then the antigen, which is isolated DNA coding for the antigen. So this is a component of the vaccines and the production of the vaccines. Then how we take the component of the vaccine and how do we perform for the production of the vaccine. On the next hand, you can see the virus or the cell presenting antigen that will isolated from the DNA and coding from the antigen, insertion of the DNA into the virus or the other cells. The viruses or the other cells are presenting to the antigen, and the fourth option is the isolated DNA coding for the antigen, and then insertion of the DNA into the plasmid vectors. Recombinant plasmid produced. The next one is plasmid enter human cells, which is very synthesized and antigen. So there are a lot of cases in the laboratories we will perform for the get the cheaper, safer vaccines. On the other hand, left in large area of the Chinese hepatitis B has been endemic for a long time, leading to the high incidence of the chronic liver disease or the liver cancers. The right incidence of the human hepatitis in the USA and the liver cancer in the children in the Taiwan. You can see the case per years is a 1 lakh per year, vaccine licensed, screening started, infant immunizations. So you can see on the paragraph. The next one is a genetic material, copy of the DNA from the pathogens, constructed plasmid, empty plasmid, DNA vaccines, and the vaccination on the deltoid muscles give. Principal vaccines used in the world to prevent the bacterial disease in the humans. The DPT vaccine, DPT means diphtheria, pertussis, tetanus, purified diphtheria toxoids, is cellular fragments of the B pertussis, and tetanus purified tetanus toxoid. Meningococcal meningitis, purified polysaccharide from the Neisseria meningitis. Haemophilus influenza is the B of the meningitis, polysaccharide conjugated with the protein, pneumococcal conjugated vaccines, which is the pneumoni, antigen conjugated with the protein. So principal vaccines used in the world of the prevent the viral disease in the human. Smallpox is the live vaccine virus, poliomyelitis is an inactivated virus, rabies is an inactive virus. Hepatitis A is inactivated virus, influenza is inactivated or attenuated virus, measles attenuated virus, mumps attenuated virus, rubella attenuated virus, the chicken pox is attenuated virus, and hepatitis B is antigenic fragments. So you can see the dose viral measles, mumps, and the hepatitis vaccines, and on the other hand is hepatitis vaccines. So typhoid vaccine is a live oral. Typhoid polysaccharide vaccines, tetanus and diphtheria toxoid absorbed for adult use. So pneumococcal vaccines, polyvalent and 5 doses injections. We have lot of examples like vaccines in our society. So next one is Japanese encephalitis viruses, rabies vaccines, Imovax rabies, and poliovirus vaccines, and the Japanese encephalitis vaccines. So lot of vaccines in our community for the prevention of the disease. Substance used for the passive immunization, gamma globulinemia, prophylaxis against the various infections for the high risk individuals such as those with immunodeficiency, lensing the intensity of the disease such as hepatitis after the breakdown. Hepatitis B immunoglobulins to prevent the infectious with hepatitis B virus after the exposure such as via blood contaminated needles. Rabies immunoglobulins used in the conjunction with the rabies vaccines to prevent the rabies. A bite from the rabid animal used around the wound to the block entry of the virus. Tetanus immunoglobulins used in the conjunction with the tetanus booster vaccines to prevent the tetanus after the serious wound used around the wound, the block entry of the viruses. Rh immunoglobulins ROGAM. ROGAM is to prevent the Rh negative women from the developing a anamnestic response to the Rh antigen for Rh positive fetus. Administration during the 3rd trimester or after the birth. So antitoxin to block the action of the various toxins such as those who have the snake venom, those from the spiders who have the produce the microorganisms including the diphtheria toxins and the botulism toxin. So slides is finished and we will meet in some another video. Good luck.